Hi everyone, hope you all are hanging in there. We are going to take a little step back. We're going to go and talk about aquatic exercise now. This is from chapter 9 in the book. I think you guys are going to like this one. It's a shorter chapter, shorter lecture, and lots of pictures. So hopefully you will enjoy this one. I am a huge proponent of aquatic therapy. I worked in aquatics for about a year and a half, where I would actually get in the water and instruct patients in aquatic therapy and do their exercises with them. And I think it can be really, really beneficial. So we're going to dive right in here, no pun intended. But the definition of aquatic exercise is basically just the use of water. So whether that's in a pool or a tank, and I'll show you some pictures later of what some different therapeutic pools can look like, that's going to facilitate the application of established therapeutic interventions. So basically, we're going to take regular old therapeutic exercises that we do, and we're going to adapt them to the water. So we can do stretching in the water, we can do strengthening, we can do even some joint mobilization and traction. We can work on balance activities, and working on balance in the water is really, really nice because it's an extra added safety feature. If your person starts to fall, you fall more slowly in the water, and the water will sort of catch them and cushion them as they fall, so it's not as traumatic as if they would fall on land. We can absolutely do gait training in the water. It's very beneficial, especially if you have pools with treadmills or underwater cameras and things like that. You can really start to analyze some gait patterns with that. And we can also work on endurance training in the water as well. So goals and indications for performing aquatic therapy would be to facilitate range of motion, initiate resistance exercise, facilitate weight-bearing activities. The nice part about doing these types of activities in the water is that some people may be able to do them in the water more easily than they can out on land, is what we say. So we have aquatic therapy and then we have land-based therapy. We can do some manual techniques in the water. We can do cardiovascular exercise. We can even do some functional activities in the pool as well. We use the pool to try to minimize the risk of injury or re-injury during rehab, and it can also enhance patient relaxation. Most pools, therapeutic pools, are heated, and so with that heat, patients can get in there, they start to feel a little bit better, it gets to work on their muscles, and they can start to relax. So some precautions to performing aquatic therapy are going to be if someone has a fear of water. We do need to use some caution when we're treating patients with some different neurological disorders in the water. Patients who have ataxia, the visual feedback from the water, because it distorts limbs underwater and things like that, may contribute a little bit more to those problems. If someone has heat intolerance, and I'm thinking specifically like someone with MS, again, because most therapeutic pools are heated, they might actually have a more difficult time in the water. And patients with uncontrolled epilepsy, again, because of some of the visual cues and things like that, that can actually trigger some seizures. So we do want to be cautious with that. We do need to be cautious with patients who have different types of respiratory disorders like COPD and things like that. When you're in the water, there is some inhibition to lung expansion, the pressure of the water, and we're going to talk about that here shortly. It does make it a little bit harder to breathe, so we do want to watch with those patients. We also want to watch patients who have different cardiac dysfunctions, things like congestive heart failure, type 2 diabetes, coronary artery disease. Again, just of how they're going to respond to exercising in water. Workloads are different in the water, and so they might have a little bit tougher time. So if it appears that your patient is struggling with exercises in the water, then maybe this is not the best option for them. Also, if your patient has small open wounds and lines, we do need to be careful with those. Small open wounds, they do make some bio-occlusive dressings that we can put on them so that they can safely get in the water. We don't want anything from their wound to get in the water or anything from the water to get in their wound and possibly cause an infection either way. So if we can cover them up, if they're small enough that we can cover them up, then they can still get in the water. If it's questionable, wait until it heals up a little bit more. Contraindications to aquatic therapy are going to be cardiac failure and unstable angina, so unstable chest pain. Again, because workloads are different in the water, you have to work a little bit harder in the water. That may overstress them a little bit. Again, respiratory dysfunction. If they have a vital capacity less than a liter, then we typically do not put them in the water. If they have severe peripheral vascular disease, if there's a danger of bleeding or hemorrhaging into the pool, again, we don't want any of that contaminating our pool. In general, I mean, the pools are large, and if they get contaminated, sorry, I was choking there. So if they get contaminated, it's going to be a long time to get them squared away and get people back into the water. If your patients have severe kidney disease, if they're unable to adjust their fluid levels, they might not be the best candidate for aquatic therapy. Again, open wounds without occlusive dressings, if they have a colostomy or any type of skin infection, we do need to not put them in the water. If they have uncontrolled bowel or bladder, they are not a pool candidate. If they have any type of infection, again, or uncontrolled seizures, then we don't want to put them in the water. So there are three major properties of water that we are going to use to our benefit in aquatic therapy. The first of those is buoyancy, and that's the upward force that works opposite gravity. So again, the biggest benefit of this is going to be the joint unloading. So you can see in this picture here, this is weight bearing with immersion. This is actually directly from your book. But if the person is submerged up to their ASIS, so up to about their hips, they're only about 50% weight bearing there. If you go up to their xiphoid process, so you go up to chest deep water, the person's only going to be bearing about 33% of their body weight at that point. If you get them in all the way up to their neck, up to C7, they're only weight bearing 10%. So if you can get that person submerged in the water, you actually take away a lot of their body weight. So like our patients with arthritis who have joint pain that's worsened by loading those joints, putting them in the water should make exercising a lot easier for them. So I have seen some people be able to do some awesome things in the water that they weren't able to do out on land. So this is providing the patient with some weightlessness, at least unweighting them to some degree. The buoyancy can also provide some resistance. So we're going to talk about resistance and how we do resistance training, but we can use this to our benefit if we have the person take especially something that's buoyant, that floats, and then pushes it down through the water. That now becomes a resistance exercise. Buoyancy is going to be affected by the amount of air in the lungs. So people who have more air in their lungs are going to tend to be more buoyant, as well as body composition. People who have more adipose are going to be more buoyant than people who have more muscle. Muscle tends to sink, and adipose tends to float. I still remember I would always tell this story. In high school, I was a lifeguard, and to do our training, as part of the test at the end, we had to actually go rescue someone. And there were two instructors that were in the pool. One, they probably both weighed over 200 pounds. One was definitely more muscular. One was a little more adipose tissue. So he floated. The other one essentially sank. And of course, I had to save the sinking guy. But body composition will play into this a little as well. And so we do need to keep that in mind with our person in the pool. So buoyancy is what allows a person to float, and we will use flotation. You'll see in some pictures here later on to our benefit as well. Another property of water, the second, is hydrostatic pressure. And that's the pressure that's exerted by the water on immersed objects. And the deeper you immerse something in the water, the more pressure is going to be put on that. So if you see and look in this picture here, just even this person standing in about chest deep, almost up to his neck water, as we go further and further down, there's going to be more and more pressure exerted against his feet, right? So the deeper he goes, the more pressure there's going to be distally. So this can help to reduce effusion and assist in venous return. So I'm thinking maybe like someone who has an ankle sprain, right? If we can put them in the water, one, we take away some of their body weight so they can walk around on that sore ankle a little bit more easily. Plus now with the hydrostatic pressure exerting itself on the ankle, we're going to help to reduce some of the swelling that's developed at that ankle as well. With the hydrostatic pressure, that's also going to help to centralize peripheral blood flow. And one thing to keep in mind is that patients are going to be able to perform more or exercises more easily the closer they are towards the surface. So again, because of buoyancy, because they can kind of float on the surface, things performed at the surface are going to be a little bit easier. The third major principle of water that's going to be important to us is viscosity, and that's the friction that occurs between molecules of liquid resulting in resistance to flow. So this is what's going to allow us to do resistance exercises in the water. So it creates resistance with active movements. If we increase velocity, we're going to increase the resistance. So the faster you move in the pool, the more resistance you're going to encounter, right? So think about being in a pool, if you've ever been in a pool, right? If you walk in the water versus trying to run in the water, right? It's harder to run because you encounter more resistance because you're trying to move faster. Also, if we increase the surface area moving through the water, we're going to increase the resistance. So the more of you put in the water, the harder it's going to be to try to move. So again, we're going to use this to do resistance training in the pool. A couple other properties of water that I do want to mention, but they're not the major three. So our major three areas or properties of water that we use to our benefit are going to be buoyancy, hydrostatic pressure, and viscosity of water. There is also hydromechanics, or the drag principle or property of water, which makes, if you move water past the patient, it makes them work harder, right? So this is why swimmers train swimming into jets. Most of therapeutic pools, or a lot of therapeutic pools, are going to have that jet feature. And so we can turn the jets on the patient and have them just try to maintain their balance, right? So the jets are going to kind of knock them off balance. That's going to be our perturbations for the patient. Or we can turn the jets and have them walk into the jets to increase the amount of resistance that they are exerting. Also, the application of equipment can increase drag and resistance. So as we get into some of the equipment later that we use in the pool, there's different types of that we can use, or different types of equipment that we can use that will increase the amount of resistance that the patient encounters. Some other properties are going to be thermodynamics, or the temperature of the water. Like I said, most therapeutic pools are heated, which is going to help to increase patient relaxation. So then you also get all those physiologic properties of heat that we talked about in modalities. So vasodilation and decreased muscle spasms and all that good stuff to try to make our patients feel a little bit better. With that being said, patients are less able to dissipate heat when they're exercising in the water. So they are going to overheat more quickly. We do need to think about what is our goal for our patients that are in the water. Again, typically these pools are kept relatively warm. If we're going to do a lot of aerobic activity, we don't actually swim like swim laps in therapeutic pools, but if you were doing that type of swimming, we would probably want to drop our water temperature a little bit. The heat is also going to increase a person's cardiac output. So we do need to be careful and monitor our patients when they are doing any type of aerobic activity in the pool, just to make sure that they're staying at safe levels. All right, so some different types of pools. I think actually both of these are HydroWorks pools, and I'm going to talk about those a little bit later, or I can talk about them now too. But traditionally, we do a field trip with this unit to the Hetrick Center in Middletown. Dr. Hetrick is a chiropractor there, and he is one of the original creators of the HydroWorks pools. So normally you guys would get in the water and get to try out these pools, but I want to show you just a little bit about what these can look like. So the first picture is kind of your traditional therapeutic pool. You see they have several patients in there at one time. They have stairs to enter this pool. So different pools have different ways of entering. Some have ramps that go down. Some will actually raise up. I'll show you again a picture of a HydroWorks pool where the floor can actually be brought up to level so that you just walk right in to the pool. This again looks like you would need to go down the stairs to get into the pool. If your patient couldn't negotiate stairs, the pool that I worked at, we had stairs to get into our pool. So if patients couldn't get in, we had a lift that could get our patients into the pool. This pool also has different levels. You can see right here, you probably can't see very well, but this black line here usually indicates that there's going to be a drop off. So this would be more shallow water. This would get deeper down here. And if you look really closely, right here and right here are actually treadmills in the bottom of this pool. And one nice thing about the HydroWorks pools, a lot of them do have the treadmills, is they do usually come with monitors or TV screens here too, so that you can clearly see what's going on with your patient's gait. This is an individual pool or a tank, and I've also been at clinics that have these either in a separate room or in the back part of the clinic, where it can be filled with water for just an individual person. So you don't need to run a whole big pool. You can just have basically an individual pool for your patient. And then you may or may not be getting in with them when it's just the tank. This one too, because it is a HydroWorks pool, also does have a treadmill in the bottom. All right, so I'm going to talk about some of the pool equipment that you're going to see or that we use in aquatic therapy. So this first picture is a cervical collar, which looks a little intimidating, but what we actually use it for most of the time is just to get the person floating on the water, and it gives them kind of a little pillow to lay on. So I've actually done some things like this. Here you can see they're using pool noodles too. That's not really special equipment. That's equipment you can get at the dollar store. But we use those just to help the patient float and relax on top of the water. I have also used these two to do some traction with the patients. So what we would do is we would have the cervical collar on. We'd give them a pool noodle or two underneath their arms. And then there are also water-resistant ankle weights that we could put on them, and then we'd let them float out in the deep end. So the ankle weights would kind of elongate their body, while the cervical collar and the pool noodles would keep them afloat, and that would actually help to traction their spine a little bit. This picture over here, this is called an aqua jogger. So this would go around the person's back, it would hook in the front, and it just helps keep them floating in deeper water, designed so that they could sort of jog in place in the water, but it's another flotation device that we can use with our patients. Swim bars are basically floating dumbbells, so some sort of material that would float. You can have individual dumbbells or one longer swim bar. And these, again, we can use these to support the patient's surface. So if you put these on the water, they will float on the surface of the water, and then you can have them like support their arm on top, and then they can run through range of motion. And it's almost like active assisted range of motion because they're being supported by the float and by the water. Or you could take these and use them as resistance exercises by pushing them down under the surface of the water. So I like these. You can do lots of different things with these. Flotation rings, you can put an arm or a leg through the hole in the middle and use them to help the person float. We can also use them for stretching exercises. So if you take one of these rings and put it around your ankle and stand upright, it'll float your leg up in front of you and help to stretch out your hamstrings. So I have a picture of that coming up for you here shortly. But we use these often either for support for flotation or to help with stretching. These are called Hydratone Bells. I call them cages. That's what we called them where we worked. But basically they are a type of dumbbell, but there's openings in the back there to put your hand inside. You can kind of see a little bit in that picture there. So if you bring them down through the water, you're going to encounter resistance that way. And as you bring them back up, so this person would be doing AB and adduction at the shoulders using these cages, you're actually going to get resistance on the way down and on the way up. Love these things. You can do all sorts of upper extremity exercises with these. You can do rows, horizontal AB and adduction, flexion and extension. These are great tools for the water. They do also make boots, so you could do lower extremity exercises as well. So you could do 4-way hip, you can do knee flexion and extension, so quad and hamstring strengthening with these, because you'll get resistance in both directions, which is really nice. These are some different types of hand paddles. So again, you could use these to provide resistance. These would essentially take the place of those cages. So you could wear these on your hands and go through shoulder motions and shoulder exercises. These are another type of paddle. We had these too, and I really like these. I like these because you can adjust the amount of resistance. So if you open them up like these are, and that will let water flow through. So as you're doing your shoulder flexion and extension or AB and adduction or your rows, you're going to encounter some resistance, but it'll still be tolerable. Or you could close the paddles off, kind of like this end, and then as you do those same activities, you're going to encounter much more resistance. So you can actually adjust the amount of resistance with these. One other piece of equipment that we use is a kickboard, which are at a lot of local pools, but you can use them, and I've used them a lot for trunk stabilization, abdominal type strengthening. So you can see in this picture what she's doing is she is doing like trunk rotations, and the kickboard is providing resistance as she goes from side to side. I've also done like a trunk stabilization exercise or ab strengthening where you let the kickboard float on top of the water, put your hands on, and then push it down through the water. And that kind of causes your abs to contract at the same time. So you can get pretty creative with some relatively simple equipment in the pool. Like I said, we use Noodles all the time. They are relatively inexpensive equipment that we can use. So here you see we're using them for flotation, just for support to help keep the person's legs up. And then here what they're doing is he's actually using this noodle for resistance exercise. So by placing his foot in, he's pushing his foot down towards the bottom of the pool. You're actually working like hip extensors and hamstrings a little bit by pushing that noodle, which would normally float, by pushing it down through the water. We're doing some resistance training. So like I said, these are HydroWorks pools. These actually, this one and this one look almost identical to what they have in Middletown. So this one, if you can see down, like everything that's white on the bottom of the pool, which would look kind of like this one in this picture, that whole thing is a treadmill. So the entire bottom of this pool is a treadmill. So normally when we go, they like to put maybe like 4 or 5 people in this pool at the same time, and then they turn the treadmill on and you're just going the whole time. So in this one, they have some handrails there for the patient. Here's the TV monitor up here. So they can watch and see what's going on with the patient's gait. And then there's also jets up here too. So if they wanted to turn them on, they could turn them on, and then the patient would be walking into resistance. There are 2 pools at the Middletown Hetrick Center. So the one looks like this, and then right across the gym, right over here, would be a pool that looks very much like this. So there's steps to get down into the pool. There's sort of a shallow area here, and then there's a step down into this area, which is a little bit deeper and has a smaller treadmill in it as well. In this pool, they also have jets. And they have them hooked up to a hose, so you can do like more localized soft tissue work and things like that. So these are the pools that I would love to take you guys to, and maybe we get there, who knows? But if not, this is what they would look like. And you can see in this picture here too, they have those yellow cages, those Hydratone Bells. They have some paddles. They have the barbells here and the swim bars. So pretty standard pool equipment that you'll see. So treatment interventions, again, we can stretch in the water. We typically use buoyancy to our advantage there. We can strengthen in the water. You can use the resistance or the viscosity of water. We can do trunk and core stabilization in the water, and we can do aerobic conditioning. So this was the picture I said I was going to show you about doing stretching. So what they did was they took a flotation ring, they put it around the patient's ankle. She's standing in the water, and that's going to float up towards the surface, which is going to help to stretch out her hamstrings. So here's one way you can do a hamstring stretch in the water. So here's a list. It's not an exhaustive list of patient types that are treated with aquatic therapy. And I almost joked on there and put like all patients. Truly, it took a lot for me to find a reason not to put a patient in a water. I can find a reason that almost all of my patients that I treated there, that I've treated in the clinic, could benefit some way from water. So again, arthritis, again, because of unweighting the joints, they do really well. So rheumatoid arthritis, osteoarthritis, it's written over here too. Following any type of orthopedic surgery. So we've got arthroscopic surgeries, orthopedic injuries, total joint replacements. Again, once the surgical wound has healed up, then they usually do pretty well in the water. Autism, balance disorders. Like I said, balance is safe typically to train in the pool. Bursitis, cerebral palsy, chronic pain. That's a pretty good one too. I've treated a lot of patients with like low back pain and things like that in the water. Patients with fibromyalgia tend to do pretty well in the water. So there's lots of benefits that we can do with those patients who have chronic pain issues. Depression, idiopathic joint pain, again, joint reconstruction surgery, replacement surgery, low back pain, osteoarthritis and orthopedic injuries, Parkinson's, MS, rheumatoid arthritis, scoliosis, stress, spinal cord injuries, sprains and strains, stroke, tendonitis, traumatic brain injuries. I had a patient who had ALS, pretty advanced ALS, and he could not walk on land. He was confined to a wheelchair, but he came to aquatic therapy twice a week. We helped him into the water, and he was able to at least do some things in the pool. He could use his arms. He could walk a few steps using the handrails. So it was really, really good to see him be able to do those things. And I think it really did help to lift his spirits a little bit to get into the water and be able to do some of those exercises. All right, so that's it for aquatic therapy. If you have any questions, let me know.